There is just nothing worse than seeing your dog get hurt. It's that moment of pure panic that every pet owner dreads. But we're going to walk through this whole thing together, from that scary first moment all the way to a full recovery, so you feel ready and in control when it counts.
Oh man, when you see your best friend like this, not able to walk, maybe crying in pain, your mind just goes into overdrive. It is totally normal to feel completely helpless, but what you do next is absolutely critical. And right now, knowing what's going on is your most powerful tool.
So the first big question we have to tackle is, what are we actually dealing with? A dog that's suddenly limping badly could have a fracture, a broken bone. Or it could be a really bad sprain, which is all about ligament damage. Figuring out the difference is the first crucial step to getting them the right kind of help fast. Okay, let's jump right in. We're going to start by identifying the signs. Understanding what you're seeing right there at home is so important. It helps you talk to your vet and just get a handle on the situation until you can get them professional care.
So let's break down the key differences. With a fracture, a broken bone, your dog often can't put any weight on the leg. It might even look, well, bent or deformed, not its normal shape. And in the worst-case scenario, what's called an open fracture, you might actually see the bone. A sprain, on the other hand, is still super painful, for sure, but your dog might be able to just touch their toes to the ground. You'll see swelling and bruising, but the leg itself will still have its normal shape.
So, once you get to the vet, you're going to hear them use specific terms to classify the break. This isn't just them using fancy medical words, it's how they figure out the absolute best way to fix it. They might say it's incomplete for a crack, simple for a clean break into two pieces, or comminuted if the bone is in a bunch of little pieces. This classification is literally the roadmap for everything that comes next.
So just to boil it all down to the basics. Fracture equals bone. Sprain equals ligament. That's the tough stuff that holds the joints together. Both are serious, both hurt a lot, but they need totally different game plans to heal up properly.
Okay, section 2. You've made it to the vet clinic. Your heart's probably still pounding, so let's just walk through exactly what's about to happen. Honestly, just knowing what to expect can really bring down your own stress levels.
The only way to know for sure what's going on is with an X-ray. And, it helps to be ready for the cost. Here's a ballpark of what you might see in the US for 2025. One single picture might start around $100, but vets almost always need a few different angles. And remember, because a broken leg is so painful, they'll often need to use sedation to get a good, clear image without stressing your dog out even more.
The whole procedure is actually pretty quick. The vet starts with a gentle physical exam and will talk to you. Then, if it's needed, they'll give a light sedative to help your dog relax. After that, they'll carefully position your pup to get those perfect shots. And the great thing about modern digital X-rays is that the vet sees the images instantly, so they can talk you through the problem and the plan right then and there.
All right, now we have a diagnosis. Let's get to the good part, the solution. How do vets actually fix a broken bone? This is where we get into the amazing surgical techniques that get your dog back on their feet.
Here you can see the two main ways surgeons tackle this. On the left, that's called an external fixator. See that rigid frame on the outside? It's connected to the bone with pins. It's kind of like scaffolding for the bone. Then on the right, that's an X-ray showing internal fixation. A surgeon puts plates and screws right on the bone, under the skin. Which one they choose really depends on the type of break, your dog's size, and their age. No matter what method they use, surgery for a broken bone always comes down to two things: alignment and stability. First, you line up the broken pieces perfectly, and second, you hold them rock solid still. That's it. The surgeon creates that perfect environment so the body's incredible natural healing process can take over.
Now for the truly amazing part, the surgeon's work is done, and the focus shifts to your dog's own body. Our dogs have this incredible built-in ability to heal bone. So let's take a look at how this biological magic actually happens.
So you have to understand, bone healing isn't like flipping a switch. It happens in 3 big phases. First up, for about a week, is the inflammatory phase. Think of it as the body's emergency cleanup crew rushing to the site. Then, for the next several weeks, you've got the reparative phase. This is where a soft callus forms around the break and slowly hardens into real bone. And finally, the remodeling phase. That can take months. That's the body refining and strengthening the bone. This timeline is exactly why your vet is going to be so serious about rest and patience.
Of course, not every dog heals at the same pace. A whole bunch of things play a role here. A simple, clean break is going to heal faster than a really complex one. A young, healthy puppy is going to bounce back quicker than an older dog. And good nutrition. That's like giving the body's construction crew the best possible materials to work with. All of these things together determine the recovery timeline.
And that brings us to our last, and you could argue, most important section. The surgery's done. The bone's starting to heal. But the final success of this whole thing, that's in your hands now. You are the #1 caregiver, and how careful you are right now makes all the difference in the world.
So think of this as your home care mission. You have to follow the surgeon's instructions to the letter. And that means strict confinement, a crate, a small room, whatever it takes. No running, no jumping, no playing, bathroom breaks are on a leash, short and sweet, and that's it. And maybe the most important thing on this list, your dog will start feeling better way before that bone is fully healed. Do not let their happy attitude fool you. You have to stay the course.
But just keeping them quiet at home isn't the whole story. This quote really hits the nail on the head. Getting them into a formal rehab program is an absolute game changer. It helps prevent things like muscle stiffening and loss of motion. Rehab doesn't just make sure the bone heals, it makes sure your dog gets back to being their old self, full of function and fun.
And this right here is a perfect example of what that looks like. Therapies like hydrotherapy, using an underwater treadmill, are amazing. The water's buoyancy supports their weight, so they can exercise and rebuild all that lost muscle without putting any stress on the healing bone. It's just a fantastic, safe way to get their strength back and sets them up for a perfect long-term recovery.
So, look at that. We've gone from that initial moment of pure panic all the way through the diagnosis, the surgery, and the long road to recovery. It is absolutely a challenge, there's no doubt about it. But it's a challenge you and your dog can get through together. So the real question is, now that you're armed with all this knowledge, are you ready to be that calm, confident hero your dog is counting on?